Good day, class. In this video, we are going to continue the discussion on central differentiation of Zang organs. The spleen. Similar to the other session, at the beginning of each discussion, we are going to revise the function of the organs. So the spleen sits in the middle jaw. The orifice is the mouth. So the problem in this session, the disorder of the spleen, sometimes will reflect in the mouth. The function of the spleen. There are two main functions of the spleen. The spleen governs the transportation and transformation. The spleen controls the blood in the vessels. And we have mentioned that the controlling blood in the vessels mostly refers to the blood vessels in the lower part of the body, which means it's below the waist. The transformation and transportation refers to the food and the body fluid. So because of these two functions, the spleen disorder will reflect in these aspects, such as the transformation and transportation of food. It can present as the food retention, poor appetite, the transformation and transportation of the body fluid can be the water metabolism problem in the body. The spleen controls blood in the vessels. If this function has problem, it will result the circulation of the blood have problems. So the patient may present with bleeding, especially the bleeding at the low parts of the body, which means it's from, such as it's from the stool or urine, or the bleeding under the skin in the in the legs. The characteristic of the spleen, also the spleen governs the rise of cilia. So for this function, the spleen needs to control the location of certain organs. The spleen prefers dryness and dislikes dampness. This situation, these characteristics will affect the spleen's the person's constitution. For instance, because the spleen prefers dryness and dislikes dampness, if a patient got excess dampness in the body, the patient may, or more possible, to have spleen disorder. So that's because of this characteristics. Vary the emotion can affect the spleen. The saliva is the body fluid of the spleen. The muscles and flesh or lumps as the body constituents of the spleen. The mouth is the orifice. So from these functions and characteristics, the spleen disorder may present in the transportation, the problem in the transportation, transformation, the food retention, the fluid, the water metabolism. And because the saliva and the mouth, the saliva is the body fluid of the spleen, the mouth is the orifice of the spleen. So in some patients, they present with like drooling. The saliva is coming out of the mouth automatically or spontaneously, especially during the sleeping at night, or if someone they have nap at noon, when they wake up, they can find that the pillow is wet from the saliva. So in this situation, patient breathing during sleeping. In this situation, we also will think about the function of the spleen because the breathing is from the saliva and also is the dysfunction of the mouth. The first syndrome, spleen qi deficiency. Similar to the other session, now you will know that's how to distinguish the symptoms. So for spleen qi deficiency, you're going to separate spleen and qi deficiency. The patient will have qi deficiency symptoms. So now you can find the signs and symptoms for qi deficiency. Lassitude, shallow breathing, reluctance to talk, a sallow complexion or pale complexion, weight loss, edema, and thus these manifestations will worsen upon movements or upon physical activities. So these are from qi deficiency. For spleen, because the spleen related to the transportation and transformation of the food. Appetite will be affected, reduced food intake, poor appetite, abdominal distension. That's because the food is not digested, especially after eating. Loose stool. So these are all spleen qi deficiency characteristics. The key points is the patient will have reduced food intake, will have distending abdomen, will have loose stool plus qi deficiency symptoms. So that's spleen qi deficiency. Spleen yang deficiency. Spleen yang deficiency, the patient also may present with similarly to qi deficiency, but again, when we mentioned about the yang deficiency, we more focus on the cold condition because yang deficiency, the patient will have relatively excess in the body, which will result in cold condition. So the spleen yang deficiency, we will focus on the cold symptoms, cold intolerance, cold lumps. As you can see, the other symptoms you also can find in the qi deficiency, poor appetite, abdominal distension or pain, loose stool, edema. That also can happen in the qi deficiency. Why the patient will have heaviness of the body? That's because of spleen yang deficiency or spleen qi deficiency. It causes the cold condition in the body. It also will result in water retention. The water retention that we can see is edema. The water retention before we can see, the patient can present with heaviness of the body, heaviness of the limbs. So that's a sign of dampness. The signs of dampness we also can see from the tongue, swollen or enlarged tongue. Perfumed nuclear. So spleen yang deficiency. Yang deficiency symptoms, the cold symptoms, plus the spleen symptoms, poor appetite, abdominal distension or pain, loose stool. So in this situation, the stool always will be loose. Why is not dry stool or constipation. The reason is because yang deficiency or even qi deficiency. The spleen function doesn't work well. It will affect the transportation and transformation of the body fluid. It can present in the tongue, cause enlarged tongue. It also can present in the large intestine. You got extra water in the large intestine. It will result in loose stool. So that's the reason for the loose stool, because of the transportation and transformation of fluid dysfunction. Spleen qi sinking. Spleen qi sinking is a worse condition developed from spleen qi deficiency. And when we talk about sinking, similar to the movement of the qi, when we introduce the basic theory, we have introduced the four types of the movement of qi. Ascending, descending, that's sinking. Another word, similar words to talk about descending. So when we talk about sinking, there must be something sinking, something descending, something move downwards. So what can move downwards? Firstly, we're going to focus on the spleen function. Similarly, reluctance to talk, dizziness, blood version. Why the patient will have blood version, dizziness? So in this condition, you will see this is the similar manifestation of the blood deficiency. That's because the spleen function, when the spleen got dysfunction, you're going to affect the qi and blood. Because remember where the blood comes from. That's from the middle jiao, which is the spleen. So that's the main organ, spleen and stomach. The main organs of the qi and blood. When spleen got dysfunctioned, we don't have enough qi. That's why the qi descends or sinks. In the meantime, when we don't have enough qi, we also don't have enough blood, because these two always happens together. So that's why the patient can present with qi deficiency syndrome and blood deficiency symptoms. That's from the spleen qi. And then followed from the thoughts of sinking. Frequent urges to have bowel movements. So in this situation, the patient has to go to the bathroom immediately. They can't hold. Something needs to go down directly. Down bearing sensation of the anus. The patient can feel that the anus is moving down, that kind of feeling. So kind of heaviness. The patient also can present with rectal prolapse, uterine prolapse, even turbid rice water, urine. This is refers to the urine, the appearance of the urine is cloudy, looks like after you wash the rice, the water, the kinds of appearance from the urine. The tongue is pale with a white coating, pulse delayed and weak. So most importantly, this syndrome, the patient will have down bearing sensation or collapsed internal organs. So these are some typical manifestations. For instance, in the other condition, a pregnant lady, she can feel the low abdomen have the down bearing sensation, the low abdomen in a pregnant lady. So this situation is actually a sign or a sign of the threatening miscarriage, which means the lady has the chance to be miscarriage. And in this situation, how can we help the lady? Firstly, this lady must lie in the bed 24/7, so to prevent miscarriage. And secondly, how we can help from the treatment to tonify the spleen, to recover the spleen function, either from herbal medicine or from acupuncture, such as the acupuncture points from the stomach points, stomach 36. That's to tonify the spleen function. So spleen qi thinking will present with down bearing sensation or collapsed internal organs, plus qi deficiency syndrome. So that's spleen qi deficiency, spleen qi thinking. If the spleen qi thinking is developed from spleen qi deficiency, that's why the patient will have spleen qi deficiency manifestations, and the manifestation of the thinking or the descending. The syndrome of spleen failing to constrain the blood within the vessels. This syndrome mainly manifests as bleeding due to spleen qi deficiency, and this bleeding mostly happens in the lower parts of the body. Bleeding mostly happens in the lower part of the body. Why we separate the lower parts and the upper parts of the body, especially from the waist. The upper parts of the body, the bleeding, we mainly refers to excess fire, such as the liver fire, the stomach heat, the bleeding below the waist, such as the bleeding in the urine, in the stool, in the urine, menstruation. These mostly from the spleen failing to constrain the blood. Also, when you can see that the gum bleeding, nose bleeding, these are at the upper part of the body. Also here, the patient may have these symptoms, but when the patient have the gum bleeding or nose bleeding from spleen fails to constrain the blood, the patient must have a pale tongue with, white coating or not, but must be the pale tongue. If the gum bleeding or nose bleeding with a red tongue, that's from the heat, from the fire, from the stomach heat or liver heat. So from spleen, it must present with pale, because this is also the spleen qi deficiency. This is also developed from spleen qi deficiency. That's why the patient will present with bleeding, mostly at the lower part of the body, and then present with all these symptoms, which are related to the qi deficiency. So various chronic bleeding, symptoms of spleen qi deficiency. That's the manifestations of spleen failing to constrain the blood within the vessels. In this situation, a lady presents with heavy menstruation. The lady also must have a pale tongue. And also this condition, as you can see, the key points, chronic bleeding, and then symptoms of spleen qi deficiency. And the patient have the symptoms of blood deficiency in this situation. The answer is yes. The reason is because of bleeding, the patient will have blood deficiency. The qi deficiency will result the bleeding, and the bleeding will result in the blood deficiency, which means the patient may present with chronic bleeding and the spleen qi deficiency symptoms plus the blood deficiency symptoms. That's the consequence from the bleeding. So that's the key manifestations of this syndrome. The cold dampness affecting the spleen. In this situation, the patient has the coldness and dampness in the body. It can be either from internal cold or external cold. Internal dampness or external dampness. No matter what's the cause, but it results in the coldness and dampness in the spleen. The patient will present with the poor appetite, distending abdomen, loose stool, the heaviness of the body. The reason is because the coldness and dampness affect the spleen function. The spleen, in order to function well, prefers dryness, dislike dampness. So in this situation, the patient will present with something cold, something with dampness, and the spleen. Tasteless. This is the first time we mentioned in the spleen syndromes. The tasteless also can happen in the other syndromes, such as spleen qi deficiency or spleen yang deficiency. The reason is because tasteless, this is something in the mouth that can happen in the spleen disorder. The mouth is the orifice of the spleen. Loose stool, poor appetite, reduced food intake, sensation of incomplete bowel evacuation, nausea, vomiting. So these are all the function of the spleen. Heaviness, that's from the dampness. Perfume leukorrhea, that's because of a coldness, edema of the limbs of the coldness. Scanty urine, that's because of the spleen transportation function of the results in the water the dysfunction of the water metabolism will result in a scanty urine. Pale tongue, white greasy coating, dampness or phlegm. So in this condition, the patient will present with something cold. On the coldness will result in a dampness because the coldness will affect the spleen function as well. Once the spleen doesn't function well, it will result in a dampness. So as you can see here, this situation, it is actually a kind of vicious circle. The cold will affect the spleen function. The poor spleen function will result in a dampness. The dampness will result in a spleen coldness. The spleen deficiency. The spleen deficiency also may result in the qi deficiency, yang deficiency, which again becomes the coldness. So these Manifestations: the patient will present with poor appetite, distending abdomen, loose stool, heaviness of the body, plus the symptoms of coldness and dampness. So that's the key manifestations. Damp heat accumulating in the spleen. In this situation, the patient has dampness and heat in the spleen. Dampness will result in qi stagnation, abdominal discomfort, stuffiness, distension, reduced food intake that's from the spleen, dysfunction, loose stool, heaviness, dampness, heat. Where can we see the heat? From a dark yellow urine, persistent fever, the tongue is red, yellow greasy coating. That's from the heat. So this syndrome can be the distending abdomen, poor appetite, fever, heaviness. Most important is the sensation after stool. Damp heat in the spleen, the patient will have a kind of sensation, a sensation of incomplete bowel evacuation, which means after they go to toilets, they don't feel relief. They're still feeling something coming out, but there's nothing coming out. So this is a very typical sensation of dampness, especially for damp heat in the internal organs. So the patient presents with distending abdomen, poor appetite, fever, heaviness of the body, the sensation of incomplete bowel evacuation, plus damp heat symptoms. Damp heat symptoms, the symptoms of dampness and heat. So that's how to identify this syndrome. In this video, we have introduced the 6 spleen dysfunction syndromes. The spleen syndromes are not complicated. The 6 you can separate into 2, which are the deficiency syndromes and excess syndromes. So the first 4, spleen qi deficiency, spleen yang deficiency, spleen qi sinking, and also spleen failing to constrain the blood in the vessels. These 4 are the deficiency syndromes. The last 2, the cold damp affecting the spleen, the damp heat affecting the spleen, are the excess syndrome. Although we didn't mention the causes of these syndromes, you can think about the possible causes by yourself, similar to the previous video. From each syndrome, you can just think about the possible causes, such as the cold damp affecting the spleen. What can cause the coldness? What can cause the dampness from the theory? So we're not going to explain here in details. You can try to explain by yourself. You also can refer to the textbooks. If you have more questions, you are more than welcome to let me know, to drop me an email or attend the collaboration. Thank you for your attention.